Hi, I'm pleased to introduce myself as Dr. Neelam Mohan, Senior Director and Head of the Department of Pediatric Gastroenterology, Hepatology, and Liver Transplantation. It was really heartening to meet Parvez today. He was more than 6 years old. He was diagnosed as a case of biliary atresia when he was close to around 53, 55 days of life. And let me talk about biliary atresia today. Biliary atresia is the commonest liver disease that is seen in small babies, newborn children, where by birth the bile duct which drains bile from or connects the liver to the intestine is called the bile duct. This is atretic or absent. And because this is atretic and absent, you need to diagnose this very quickly because otherwise the liver is going to get damaged rapidly. Now, there are two types of biliary atresia. One which actually progresses in utero, that is right from the mom's womb. So, these babies are actually having a liver which is maybe already fibrotic by time within couple of weeks of birth. And the other variety is where they progressively it goes on getting bad. Clearly, research and experience has shown that if we do not diagnose these patients early, they will not be successful. What do I mean? Now, since the duct is not formed, the only way I can save these children is through a surgery. The surgery is called either a Kasai potoenterostomy, where we connect the bile duct where it ends in the liver, since that is atretic. So it's called the porta or the hepatic region of the liver directly to the intestine. And if the disease is advanced, then the only thing that can save this baby is a liver transplantation. So earlier on we used to say we should try to do this surgery within 60 days to get a good success, but there are a lot of papers from the Western world and from Korea, Japan, France that actually if you do between 30 to 45 days, they are even better. So this surgery is not 100% successful. Even in that surgery, it depends upon the expertise of the surgeon. What is the state of fibrosis that was already, how much the liver was already damaged by the time of surgery? What is the age of the baby? These are all the factors which will contribute to the success. On an average, we say that 50% success rate if it is done early within 2 months of life. And those babies who do not have success, they end up with liver transplantation. Coming back to Parvez, you saw long scar on his tummy. So he underwent this Kasai potoenterostomy at around 55 days of life. And touchwood is now 6 years and is doing very well. His liver disease is not progressive, his enzymes are okay, his bilirubin is normal. And he came to say goodbye because the family is now moving on to Canada and wish him all the best for it. But they need to be constantly under supervision of a specialist or hepatologist to monitor his liver, because some of these babies in the long term may need a liver transplantation. So the message today was that even in biliary atresia, timely surgery can save a child. And how do you diagnose this? That baby is got jaundice, the bilirubin, direct bilirubin is increased, the color of the urine is dark or yellow, the color of the stools is not haldi yellow, but it is pale, light pale. That is the way they are. They are otherwise active and thriving, and that is the reason they get missed. So all parents, it is your responsibility to ensure that if your baby has a dark urine or light stool, please consult a pediatric liver specialist, a pediatric hepatologist to sort out their problem and understand, so that there is no shortcut to this diagnosis except a surgery. Timely surgery can save you from a liver transplantation, and the incidence of this is 1 in 10,000 to 15,000 births.